thank you all for coming this afternoon. It's a real honor to be invited here and to see so many people in the room. I'm really thrilled to be talking about feedback and coaching in particular in CBME, as I think that you are a group who are sort of embedded in this work in the middle of it, and that there's lots of learning that each of you have to share. So that, hopefully what I have to say, some of it may be novel. I can appreciate that maybe you're really quite far along in the process, and I'm sure that I'll learn lots from you as well. So thank you very much. So my objectives, very briefly, given half an hour, is just to review the role of feedback and coaching in CBME, review research and coaching, especially a little bit on the culture and the components, what makes up coaching, this thing that we're calling coaching. I'm going to describe the R2C2 coaching model, which is my field of research for the last 6 or 7 years, and just very briefly talk about some research findings around that, and then talk about challenges moving ahead, which then I'll be really lucky because the panel that's coming up are going to be addressing a number of those challenges. So it will be a really nice segue, and they can provide some of the answers. So the goals of CBME, I'm sure that you've heard these before. I understand that Eric Holmboe was your visitor this time last year, and I've probably taken this from one of his publications. He, if you know, in June of 2017, there were an updated series of articles on CBME, and Eric was one of the lead authors again. So the goal of CBME, as he points out and others point out, it's really towards the population to improve healthcare outcomes, reduce errors, increase safety. So that's the goal that we have to keep in mind when we're down here at a lower level, feeling like we're working in the ranks in the streets and not quite seeing the forest for the trees, that remembering that's what we're doing it for. The other one is for learner development, so that they can provide that safe care, and so that we can help them to progress and grow as efficiently, as effectively as possible. And although I think within the CBME rhetoric, we often hear the word assess, perhaps more than we hear the word develop and grow, but that's really the goal of CBME, is to help our learners develop and grow as effectively as possible to give that safe care. So I want you to think, well, first of all, I'm going to comment on this little guy, why I chose this little guy climbing up a ladder to be on some of my slides, because for me, it really represents CBME in just a really simplistic way. It's the learner climbing up, one milestone at a time. And what isn't there is the coaching and so forth, and the supports that faculty provide. So just take a minute at your table or with the person next to you and talk. What are the differences between feedback and coaching? These are suggestions made by Heen and Stone, which are actually authors of a book on feedback that, Sue, you have there. What is it called? It's the Thanks for the Feedback. I don't know whether some of you know this book, but it's excellent. And now, mind you, they wrote this in 2014 when I think people were just beginning to talk more about coaching from an educational sense. And so they talked together, and I guess it was about assessment and feedback that tells you where you stand, where you measure up, how you measure up, what's expected, and it can feel a little bit intimidating and emotional. And then I think the points that you folks brought out at this end of the room about coaching, it's longitudinal, and the points that really resonate with me, this notion that enables you to learn and improve and helps you play at a higher level. Like, to me, that really sort of says what we mean when we're talking about competency education. We really want our health professionals to play at a higher level. We want them to move up that ladder and to be able to perform more efficiently and effectively and to learn as effectively as possible. It's learner-centered, it would be longitudinal. However, the point that you make, that coaching needs specific, descriptive, timely feedback data. And I'm going to use these words, feedback and data, a little bit differently, and people have different views of what feedback is. But we really need, if you think about data, that you need data of some kind. And when you observe a learner, you're collecting data about that learner's performance. Or if you're a program director reviewing a learner's portfolio, you're reviewing the evidence that's been written about that learner. That's the data. So in the next slide, I'm going to give you a written feedback exercise. So this is an end of the rotation iter. I put which thankfully is disappearing. I think isn't that, hopefully there isn't, gosh, if someone here is really wed to iters, I apologize. We can talk afterwards about why perhaps, that at least in their current format, why maybe it's helpful that they might be disappearing. So I want you to critique this feedback. This comes from a busy program director who assures me that this is often what she reads on iters. And so try and look at this as this resident's coach. Is it specific enough to help the resident improve? Is there consistency between the scores and the narrative? And does the narrative provide enough description, i.e. data, to guide the coaching? Okay, so I'll slide it up and give you a few minutes to take a look at it and then see what you think. So I've listed each of the CanMed's roles, just told you how many items for each, and then I gave you the average rating, and then the overall rating at the bottom. And then the comments that were written about Dr. R. So if anyone has any observations around, is it specific enough? Is there a consistency between scores and narrative? Could you coach this learner based on this feedback? Can you give me some specific examples? But what's the conflicting evidence for timeliness in clinic? They got a 5 on professionalism. Right? And this happens. The other question is the narrative sort of written in some kind of code? Is it skirting the issues? And here I'm borrowing from Schifra's wonderful work around what we write on our formal evaluations, like this code around what needing a written plan for enhancing knowledge, like what does that mean, for example? So I'm using this just to highlight the fact that in order to coach, we need to have good feedback. Good feedback means good data. So requirement number 1 for coaching: specific, objective, relevant, timely narrative description of the observed behavior. And that's the actual data, the performance data, in the same way that a basketball coach or a skating coach would have observational data to base their coaching on. What you've observed if the learner, if you're giving feedback in the moment, or what you have in that written narrative if you're doing it longitudinally and over time, that's the data that you have. Sorry, and as we all know, numbers don't tell you how to change. That being a 3 or being a 4 doesn't tell you how to improve. And so words have power. And so I think that's part of our message around being able to coach, is that we need those narrative descriptions, or we need to be able to observe a behavior and describe back to the learner what we observed and confirm with them, is that what you thought you were doing? Or am I on track when I say I saw you do X, Y, and Z? So remembering that words have power. Then as far as the role of words and feedback and coaching and competency-based medical education, this model depicts this triangle pyramid, yet another pyramid in education, depicts the progression, the developmental levels from novice to advanced beginner to competent to proficient to expert. And it's really the words, the feedback, and the coaching that we provide to our learners along the way. And I mean that in a rigorous and structured way that will help them move more efficiently from one level to the next. And so for me, CBME is more thinking about the words and the feedback and the coaching that we can share with our learners to help them get better, rather than the assessments. That if the purpose is really for them to be able to develop, how can we help them develop efficiently and effectively? Mind you, we need to assess that as well. However, perhaps it's time for the pendulum to swing back a little bit to the learning side and focus more on how we can help them learn. So now I'm going to move on to the role of culture in influencing feedback and coaching. And this is another area where quite recently some of our colleagues have been devoting their study. First of all, does anyone know where this quote comes from? Or it's something like that, like culture eats evidence for lunch. That if we're just, we are entrenched in doing something the same way, and even if we're presented with the evidence that we shouldn't do it any longer, we just do it because it's easier. And so there's lots, there's been evidence, 20 or 30 years of evidence that we're not doing feedback well, and there's barely any change. So that's not the answer. So what are we learning? We've learned lots from Chris Watling, and I'm sure I would expect that he's perhaps been here and chatted with you at times, and you've had lots of chance to talk with him. And his PhD was on feedback, and especially studying the culture. And this really rings true that medical and medical education culture emphasizes autonomy and independent practice, and that prevents direct observation of performance by faculty and acts as a barrier to open feedback. Would you agree? Am I saying anything that, we're all high achievers, we all want to be excellent, we all want to be autonomous, and so therefore it makes it hard. It makes it hard for us to think about being observed and receiving feedback. And then I'm not sure if you're familiar with Suba Ramani, who is actually a PhD candidate at the University of Maastricht, and is just, and you may know that PhD program is compiled of a number of papers, and she has just published a number of her papers, as you can see, 2 towards the end of 2017 and one in 2018, all in medical teacher. The last one in 2018 is 12 tips for enhancing a feedback culture, so really timely for us. And then the academic medicine one was a publication, what's that? What's PAP? PAP? Publication? Published ahead of print. Thank you very much. And that one is on her qualitative research around a culture of politeness and excellence. And so I was reading these just over the last couple of weeks. And again, it helps. She builds on Chris's work, which was quite wonderful, and really talks about, not only the excellence that, believing that we're all excellent or working as at a high level, but also this politeness, this notion that we don't want to say something that's going to, upset the apple cart or that's going to ruffle our relationships. And so when we look at this, we can understand why it is so challenging for us to really develop this a culture where feedback is accepted and where it's sought and where it's given in appropriate ways. So those now there weren't printouts of my slides, but I'll certainly leave them and they can be distributed, and I can certainly share these references, and Shifra would have access to them as well, as she is, my wonderful colleague at Dalhousie, Karen Mann, was one of Suba's supervisors, and Karen passed away a year and a few months ago. And so, Shifra, I understand that you've stepped in and are working with her. So you have a wonderful connection to this work. So this is another quote from Chris. Coaching requires a shift in philosophy. So why don't you just read this and just tell me what you think? I see a few nods around the table, and I heard some of you in your when you were describing coaching using words like that, and it really sets, you can really see the dichotomy, can't you? It isn't about the finite exercise of teaching something to someone, but about the infinite exercise of continuous improvement. And so thinking that if we as faculty can start to model that continuous improvement, if we can start to change the culture in our own departments or divisions by asking for feedback from others and saying that, being open when we don't know something or when we made a mistake and asking for help, that again can maybe begin to change the culture towards where our learners will see that it's okay not to it's okay to ask for help, and it's a path of continuous improvement. I put the website that Chris had written that in one of the school, his school's newsletters, but I just thought it really described it nicely. So coaching is about promoting growth. It's about getting better. It's longitudinal, based on goals. And so it's really about a growth mindset. How many of you are familiar with Carol Dweck's work on growth mindset? You? I'm just going to show an excerpt of a video as it describes the difference between a growth mindset and a fixed mindset. And I think thinking of a fixed mindset, that if you think you're already at the top of your game, you're already excellent, then it's hard to think of room for growth. And so it's helpful for trying to think about this growth mindset and how we might help our learners. One of the studies that we did at Dalhousie was around residents and trying to understand if they would ask for feedback and under what circumstances they would ask for feedback. And so you think, asking for feedback is a growth model, right? That you're asking to learn how to do something better. And what do you think their response was when we asked them? This was 6 or 7 years ago, so maybe the culture is changing. But their response was, you don't want to put your hand up. You'll be there like a red flag saying, I don't know something. So therefore, I just stand at the back and hope I can learn whatever it is that I don't know by just listening to others. So to me, it's a pretty compelling example and this was shared by the group of residents that we were studying. It's a pretty compelling example that it wasn't there. The culture did not promote a growth mindset. And so I'm just showing it to you as something to think about, and to think about how can each of us in our own environments begin to support that growth environment. Maybe not all the time, but perhaps a little bit more, at least in my school, a little bit more than we do already at Dow. So let's move back to coaching. This is a definition of coaching in education. So when we started talking about coaching, people immediately went to the sports coaches definitions. In education, I think we think about it differently. This is an involved one. It's a one-to-one conversation focused on the enhancement of learning and development through increasing self-awareness and a sense of personal responsibility. So this really brings out the idea that you're not just coaching in that moment for them to do that one task better, but you're also coaching because you're trying to develop those skills of self-directed learning and self-critique. So the coach facilitates the self-directed learning of the coachee through questioning, and usually open questioning, active listening, appropriate challenge, and in a supportive and encouraging climate. Now, I can imagine that you would look at that and say, oh my goodness, we can never do that in a really busy clinical setting when I only have 2 or 3 minutes with a learner. However, there are aspects of it that you can sort of work on. Even the fact of asking open questions shows that you're interested in the learner, and I'll talk about that a little bit more when I talk about my own research. So that's one definition to think about. So let's talk a bit now about what's involved in this activity that we're calling coaching. And this is work from Ben Lovell's systematic review published just before Christmas. And also from other work as well. So the coach provides individualized real-time feedback, i.e. performance data. So we saw an ITER, that would have been, at the end of a rotation, but if it's in the moment, it would be that individual feedback, what I observed when I saw you doing something. The coach and the coachee set individualized goals for the coach, for the coachee, for the learner. So it's co-development. It's the moving away from the more directive model where the faculty says, well, I think you need to do this, this, and this. It's trying to build that self-direction by coaching them in what would be appropriate goals. The coach facilitates the development of new behaviors, insights, and approaches to work. So again, it's working to facilitate the learner's growth. It's learner-centric, trying to foster reflection. So what did you think went wrong here? Can you tell me what you were thinking when you did such and such? So just trying in a very few minutes to get them to think through what they were doing and to self-critique and to think about what they should do next. And this one is interesting about the coach, has an analytical understanding of the game, what the game's all about, like the game of medical education or to become a surgeon or whatever, an ability to motivate the learner towards excellence. So, and in other words, they sort of know what good looks like, even if perhaps it may not be in their area of specialty, that they know what it means to be a good clinician. You need to have a set of skills, and so that they can coach from that holistic perspective. I'm going to say just a few words about the body of research that I've been part of for a number of years. And where's Ivan Silver? He's over there. He's been part of it for a while as well. And this is just a local study that we did at Dalhousie, and then a larger international study at the bottom about the R2C2 model. And you have a brochure. There's a couple of brochures on the table. The thing is, just due to the limits of time, I'm not going to go through the model in detail because I want to share some of the research with you. I'll go to okay, first of all, I'll tell you. So the theory, a lot of theory, and we gave this a lot of thought and had some prior research on self-assessment and receiving and accepting feedback before we came up with the model. And there were three bodies of sort of theory that inform this work. This notion of informed self-assessment, that we need external feedback to inform and let us know how we're doing. And so in order to get the learner to reflect upon what external feedback they need, you need to ask open-ended questions, you need to guide reflections and guide them to self-critique. It uses learner-centered approaches, so you're really focusing on them based on humanism. You want to foster their motivation and support their self-direction. And then the third area are the cognitive domains influencing behavior change. We know that there are many factors that influence behavior change, and we started using a learning change plan to address these, just to help that scaffolding, help that learner move up the ladder. So it's a 4-stage model, and you'll see in the brochure, and in the brochure we give the purpose of each of the phases. They're iterative, you can go back and forth between them, and some phrases that are used. The phrases are taken from our research. They're ones that facilitators have actually used, and residents have said that they're helpful. So the first phase is the rapport building or the relationship building. And what we've heard from residents and supervisors, that even if they know each other fairly well, you can still learn more about them, asking questions like, well, what kind of feedback have you had before? What is really helpful for you? What did you really gain from this past couple of weeks? What are your goals? So again, thinking of whether it's in the moment or when someone comes to your clinic just for a day, or whether it's a 2-week or the end of rotation session that you're doing. Then exploring their reactions. So and this really comes from the work on informed self-assessment, that if you don't agree, if the feedback you're getting doesn't confirm how you see yourself, it's often a surprise, and it can often be an uncomfortable surprise. It can make us sad. It can make us angry if we get negative feedback. And so being upfront and asking, were there any surprises in what I told you about my observations? Or are there any surprises on this end of rotation form that we're reviewing? And then just to talk about those and bring it out on the table and have a conversation and normalizing it. We're all disappointed when we have feedback that doesn't quite jibe with how we think we're doing, and having that conversation. Then moving into the first C, which then once you get the reactions and the emotional part over, then moving into the content, the knowledge bits. So did what I just described to you when I observed you taking out those sutures or whatever it was, did it make sense to you? Can you understand why I made the comments that I did? And are there questions that you have? And let's make it something more complex. Maybe it's time management around managing a roster of patients. This is what I observed. What do you think? And then where are the opportunities for improvement based on my observations and how you think you're doing? Where are the opportunities for improvement, which really gets to the coaching for change. However, what we're finding is that you sort of almost have to go through, those 3 levels beforehand to get to the coaching, to come to that agreement as to what to work on. So that's what the brochure is about. This is the coaching then is real. What we, in the last research that we did, we used a learning change plan. And this is what it looked like. And you can see it's quite involved. It's got the describe specific observable changes that you intend to make, the specific actions, the timeline. Timeline 2, when do you think you'll see results, identify the resources, the challenges, and how do you know if you've been successful? When we handed this out in the study, our study, we thought that it would be too complex, but in fact they said that it was helpful. Now mind you, it wouldn't be helpful, it would be too complex for in the moment feedback at the bedside or in the clinic. But thinking about it when you're doing your monthly or a tri-monthly or every 6 months sort of progress meeting with residents, this might be a tool that would be helpful. So the goal really of the R2C2 model is to try and, through this facilitation, to try and facilitate the notion that this is feedback is external, it's external stuff coming in. It's not in control, it's a threat. And it could even be about something that's bad, something I'm not doing well. So trying through this listening, open questions, accepting, motivating, coaching, trying to help the residents realize that this is their data to use. This is your data and it's your opportunity, and you can be in control of using it for change. I know it's pretty Pollyanna-ish, but it's a goal. It's a far-reaching goal. And actually I've heard from a unit that's been using it for a couple of years that it is actually beginning to change the culture slowly. So I'm just going to go, if I got 2 more minutes, all right. So the overarching from our research, which was an international study on 5 sites, what was valued by both residents and supervisors in using the model? They valued the facilitation of the resident engagement and reflection. They valued the focus on getting better. They valued the collaborative supervisor-resident relationship. They created that learning change plan together. They found it useful with residents at varied levels, especially those that were excelling. And then their recommendation was to orient and prepare residents in the same manner as faculty. And I think later on this afternoon you're going to hear more about developing and preparing residents and faculty together for a change in culture. I'll just very quickly go through some of the quotes. And this one was around engagement and reflection. Because it was so different, I guess you're less likely to be defensive. Because a lot of it was just identifying my own weaknesses, he helped me to come to that conclusion, and he prompted me to self-critique. The one about the outcomes orientation, I'll just let you read that one. So valued the focus on getting better, really the specific strategies to take to get better. The collaboration and co-creation of a plan, we came up with the goals together. what I liked about it was the supervisor said, what can we do? Can you achieve your goals? And the resident said, it makes me motivated to know I've got that support. Finally, with residents who were excelling, supervisors reported that it was benefit because they said it provided more substance and structure for their feedback conversations. So it gets you to the next level. It gives you more to say. Normally, I would have just said, hey, you're doing well, carry on. So they said that using that format, even if they didn't write it down and fill it out, it gave them questions to ask. Ask them, what do you aspire to, even if you're excelling in everything already. What would you aspire to, and how might you set goals, and when would you like to achieve them, and who do you need to help you? So asking questions that weren't available before. And I think I'm just going to finish up. Summary and next steps, yes. So this is summary overall. That was just a very brief overview of the research that we did. I've been thinking about CBME, and again, this is from Eric Hombo's work. Point out it's an evolution, it's dynamic, it's not finite. And it makes me think it's a disruptive technology. It's shaken us up, and it's made us realize that our education and the systems and cultures, don't probably value sound education principles as much as they should. The kinds of things that we've just been talking about are really based on sound education principles, like things that should be the foundation of our programs: assessment for learning, observation to collect data, longitudinal relationships, safe, respectful environment, coaching our learners to become the best that they can be. And I think as far as changing the culture, I think we first change the culture by changing ourselves. And we know that one of the best ways to change a culture is by role modeling, and so in this case being open to feedback and role modeling various other ways of trying to be more open and open to learners giving us feedback. So thank you very much, and I think we have some time for questions, and then I'll look forward to the panel. Thank you.
You indeed have time.